All right, so let's jump into some really interesting research that's kind of shaking things up in the world of AI and healthcare. We're talking about predicting stuff like how long you'll be in the hospital, or even if you might have to go back after being discharged. We're looking at this paper called ClinicalBench. Can LLMs beat traditional ML models in clinical prediction?
Yeah, this research really digs into whether large language models, LLMs for short, the kind of AI that's been making headlines for passing those medical licensing exams, can they actually do better than the traditional machine learning models that have been, the go-to for clinical prediction for years?
Right, because passing an exam is one thing, but making accurate predictions about real patients, that's a whole other story.
Mhm.
So for our listeners who might not know much about these traditional models, what exactly are we talking about?
Well, think of them as the tried and true methods. Like algorithms such as XGBoost, SVM, logistic regression, they've been analyzing patient data and making, decent predictions about things like length of hospital stay, risk of mortality, chances of readmission. Been around for a while.
Okay, so they've got that experience, right? But now we've got these LLMs kind of bursting onto the scene, showing off their fancy language skills, saying they can reason like a doctor. So how did the researchers actually set up this AI showdown?
They created ClinicalBench, basically a testing ground to compare the two approaches head to head. They focused on three prediction tasks: length of stay, mortality, and readmission.
High stakes stuff for sure. And to make things even more interesting, they used real patient data, didn't they?
Absolutely. They use these two large public data sets called MediMe3 and MiniMe3. Both of those contain de-identified data from actual ICU admissions. So we're talking about real-world scenarios, not just textbook cases.
So no pressure on our AI contestants then. What was the first challenge they threw at these models?
Round one was all about direct prompting. So they gave the LLMs raw patient data, stuff like diagnoses, procedures, medications, all written out in plain language. And then they just asked the LLMs to make their predictions, kind of like a pop quiz.
Straight to the point. And how did they handle this straightforward approach? Did the LLMs live up to all the hype?
Well, this is where things get interesting. The traditional ML models actually did better in this round.
Wait a minute, the LLMs with all their fancy language skills couldn't even beat the old guard. That's surprising.
Yeah, the results were pretty clear-cut. And even more surprising, they tried tweaking different LLM settings, like something called decoding temperature. They even tried bigger, more complex models, but they still couldn't catch up.
So what does that tell us about these LLMs? Are they all talk and no action when it comes to these real-world clinical scenarios?
Yeah, it raises some interesting questions. One possibility is that maybe LLMs are really good at memorizing medical facts, but they struggle when it comes to applying that knowledge in a subtle way, like a doctor would.
That makes sense. A doctor doesn't just rely on textbooks, right? They consider the individual patient, their situation, all those subtle things that an AI might miss.
Exactly. There's this element of like contextual reasoning, judgment that seems to be crucial for clinical prediction. And that's something the researchers really wanted to explore further.
Okay, so round one went to the traditional models, but I'm guessing the researchers didn't just give up on the LLMs there. What did they try next?
In round two, they decided to give the LLMs a little bit of help. They tried this thing called prompt engineering.
Prompt engineering. That sounds pretty technical. What exactly does that involve?
Well, imagine you're asking a friend to grab some groceries, right? Instead of just saying, get groceries, you might give them a detailed list, maybe tell them which store to go to. Prompt engineering is similar. It's about giving the LLMs clear instructions and context to guide their predictions.
So instead of just throwing patient data at them, they're trying to structure the task in a way that kind of helps the LLMs understand what's being asked.
Exactly. And they experimented with a bunch of techniques. For example, they tried chain of thought prompting, which basically guides the LLM through a step-by-step reasoning process, almost like showing it how a human doctor might approach the problem.
Oh, interesting. So they're not just feeding the LLM information, but actually trying to teach it how to think like a clinician. Did that make a difference?
They also tested something called self-reflection prompting, where they encourage the LLM to evaluate its own prediction and look for potential weaknesses in its thinking.
So it's like asking the LLM to double check its work, think critically about its own thought process. That's pretty meta.
It is. And they even tried role-playing prompting, where they told the LLM to actually take on the role of a doctor making a clinical decision. They were hoping that would help tap into that vast medical knowledge, but in a way that's more connected to the specific situation.
Wow, it sounds like they were really trying to get inside the mind of these LLMs and figure out how to get the best out of them. So after all that coaching, Did the LLMs finally step up their game?
Well, unfortunately, even with all these fancy prompting techniques, the LLMs still couldn't consistently do better than those traditional ML models.
Wow, those traditional models are tough to beat. But I'm sure the researchers had one more trick up their sleeve, right? What was their final strategy?
For round three, they brought out the big guns,
Yeah.
fine-tuning. This is where you take a pre-trained LLM and you give it specialized training using like a subset of the data that's specifically for the task you want it to do.
So instead of relying on general medical knowledge, they're tailoring the LLM's training to these specific prediction tasks, like sending it to a specialized residency program.
Exactly. And while fine-tuning did lead to some improvement, particularly for length of stay and mortality prediction,
There's that but. Again, what was the catch this time?
most of the fine-tuned LLMs still couldn't quite match the best-performing traditional models. And there were some interesting inconsistencies, like an LLM might do great on one data set, but then struggle on another. It wasn't a clear victory.
So even with that specialized training, those traditional models are holding their own. What do you think is going on here? Why are LLMs having such a hard time cracking these clinical prediction challenges?
It seems like the data itself might be the key. Remember, we're dealing with real-world medical data. And that's incredibly complex, nuanced, even small variations between data sets, like how the data was collected or the types of patients included. Those things could really affect the LLM's ability to learn and make accurate predictions.
That makes a lot of sense. It really highlights how hard it is to develop AI that can really grasp the intricacies of real-world healthcare. So after all these rounds, where do we stand? Are the LLMs ready to hang up their stethoscopes and admit defeat?
Well, this research definitely kind of throws some cold water on the hype that LLMs are about to replace doctors anytime soon.
Mhm.
While they do have a ton of potential, we have to be realistic about their limitations, especially, when we're talking about people's lives. What's kind of fascinating is like we're seeing this push and pull between all the hype and the reality when it comes to AI in healthcare. It's easy to get caught up in the excitement of AI passing medical exams, making diagnoses, but this research really reminds us that clinical practice is way more complicated than people think.
Right. It's easy to jump to the conclusion that AI is going to replace doctors, but this study suggests that it's more complicated than that. It's not really AI versus humans, but more like how they can work together.
Exactly. Instead of worrying about being replaced, maybe doctors should be thinking about how AI can become a tool that helps them do their job even better, like a collaboration, not a competition.
So like having a super smart assistant,
Right.
helping them go through data, make more informed decisions.
Precisely. LLMs could analyze tons of patient data, see patterns a human might miss, maybe even suggest treatment options. But ultimately, it's the doctor who brings their experience, their intuition, that understanding of the individual patient, right? That human element. You can't replace that.
Totally. It's not about AI taking over, but about AI making doctors better at what they do. So what about the patients? How do these findings affect their experience?
Well, one potential benefit is like better accuracy and efficiency in how diagnoses are made and treatment plans are created. Like imagine AI helping doctors process information quicker, leading to faster diagnoses, more targeted treatments. In the end, better outcomes for patients.
So shorter hospital stays, fewer complications, quicker recovery. Yeah, those are benefits I think everyone can get behind.
Absolutely. But like any really powerful technology, there's some challenges we got to consider as these systems are, you know, developed and put into practice. Like making sure patient data is protected, used responsibly, that's really important.
That's a huge point. We talk about AI needing more data to get better, but privacy and security, that can't be ignored.
Exactly. And that's something researchers, developers, policymakers, they all got to address this head on as this technology keeps advancing. It's not just about the technical stuff, but the ethical and practical parts of handling sensitive medical data.
So we've talked about the benefits for doctors, patients, but what about the impact on the healthcare system itself? Could these findings change things like costs, resources, or even how we train new doctors?
Definitely. One potential impact is like increased efficiency and lower costs.
Huh.
If AI can do some of the tasks, like administrative work, even some initial diagnosis, that frees up doctors to focus on more complex cases or just spend more time with their patients.
That would be huge. Less burnout for doctors, more personalized care for patients, maybe even a way to address those staffing shortages we keep seeing in healthcare.
Exactly. And when it comes to resources, AI could help predict what patients need and allocate resources better. Think about it accurately, predicting who's at high risk for readmission. Hospitals could then put things in place to prevent that. saving money and improving patient care at the same time.
So AI is not just about replacing jobs. It's about making the whole system work smarter for everyone. What about medical education? Will we need to change how we train future doctors with all this AI stuff happening?
No, absolutely. Understanding AI is becoming a must for doctors. They need to know how these systems work, the good and the bad, and how to use them effectively and ethically.
It's like that collaboration idea again, right? Doctors and AI working side by side, both bringing something unique to the table.
Exactly. Medical schools need to adapt, add AI to their curriculum, teach students not just how to use the tech, but to think critically about what it all means. It's a pretty big shift in how medicine is practiced.
This whole conversation just highlights how fast AI in healthcare is changing. What are some of the bigger trends you're seeing, beyond what we saw in this specific study? What's next? What's coming down the pipeline?
One thing that's really cool is this idea of combining different types of AI, like LLMs with other machine learning approaches, or even computer vision.
So not just analyzing text like in this study, but AI that can look at images like X-rays, scans, maybe even videos of patients interacting.
Exactly. Imagine an AI that analyzes your medical history, imaging results, even your tone of voice during an appointment to get a much more complete and personalized assessment. That's the kind of multimodal AI that's starting to pop up.
It's like an AI that sees the whole picture, not just a little piece of it. Any other big developments you're keeping an eye on?
Yeah, personalized medicine using AI, that's getting a lot of attention. The idea is to really tailor treatments to each patient, factoring in their genetics, lifestyle, even their personal preferences.
It's like custom-tailored healthcare, moving away from the one-size-fits-all and using AI to create personalized treatment plans.
That's a perfect way to put it. And this has the potential to totally revolutionize how we approach treating diseases, leading to more effective treatments, fewer side effects, better outcomes across the board.
Okay, multimodal AI, personalized medicine. Anything else groundbreaking coming our way?
We're also seeing a lot more interest in using AI for drug discovery and development. Think of AI systems going through tons of data about chemical compounds and biological info to find potential new drugs. This could speed up the whole process, maybe even help us find cures for diseases that are incurable now.
Wow, AI helping us find cures for diseases that have been around forever. That's kind of mind-blowing.
It is.
Okay.
But just like we talked about before, it's super important to be careful and keep the ethical side of things in mind. We have to make sure these systems are developed and used responsibly, always putting the patient's safety and well-being first.
Totally agree. It's not just about the cool factor of AI, it's about making sure it's used in a way that helps everyone. So for our listeners who are probably thinking, okay, this is all great, but how does this actually affect me? How long until we see this stuff become real in our everyday lives?
Well, some of this is already happening in clinical practice, although in limited ways.
Yeah.
We see AI being used for things like image analysis and radiology, early detection of certain cancers, even personalized treatment recommendations for some conditions.
So it's not just a futuristic dream anymore. AI is already making a difference, and it seems like it's only going to get bigger in the next few years.
Definitely. As the tech improves and we gather more data, AI is going to play a much bigger role in healthcare. Hard to say exactly how it'll all play out, but it's clear AI has the potential to completely change healthcare as we know it.
Yeah, this is definitely something we'll have to revisit as things develop. But for now, I think we've covered a lot. In the next part of our deep dive, we're going to zero in on one of the most interesting things about this research, how they prompted the LLMs and how that affected how well they did. It's like taking a peek behind the scenes to see how these AI systems actually think.
Hmm. All right, so we've talked about how LLMs are showing some real promise in healthcare, but they're still not quite there yet when it comes to beating those traditional ML models. And one of the things the researchers really focused on was like how to talk to these LLMs, how to give them the right instructions to really get the best out of them.
Yeah, prompting is a big deal when you're working with LLMs, like giving them those cues they need to, focus their attention and guide how they think. Remember, these models are trained on a ton of text, so they need clear instructions to understand what we want them to do. Right. It's not just about dumping data on them. It's about asking the questions the right way, giving them a structure to work within. And in this ClinicalBench study, they tested out a whole bunch of prompting techniques. What were some of the more interesting ones they tried?
One that really stands out is chain of thought prompting. This is where you basically guide the LLM to break down a complex problem into smaller, more manageable steps. almost like you're showing it a thought process, step by step, logical.
So instead of just giving them the patient data and saying, predict the length of stay, you're kind of walking them through how a doctor might think about it, considering all the different factors.
Exactly. The idea is that by making that thought process more obvious, you help the LLM come up with a more accurate prediction, like giving it a scaffold to build its thinking on.
That's really cool. Did they find that this chain of thought prompting actually made the LLMs do better?
Well, it was kind of mixed. Sometimes it led to small improvements, suggesting that, yeah, guiding the LLM's reasoning can help. But it wasn't like a cure-all. They still struggled to consistently outperform those traditional models.
So helpful, but not a total game changer. What other prompting techniques did they try out?
They also looked at something called self-reflection prompting. This basically encourages the LLM to look back at its own predictions and try to find any weaknesses in its thinking.
It's like asking the LLM to double check its work and think critically about how it came to that conclusion. Right. Almost like metacognition for AI.
Exactly. They were hoping that by prompting this kind of self-reflection, they could push the LLM to refine its predictions and be more accurate.
That's fascinating. So, did this self reflection approach lead to any noticeable improvements?
Again, there were some promising signs, but nothing definitive. In some cases, self-reflection did seem to result in slightly better predictions, but it wasn't consistent. I think we need more research to figure out how to best use self-reflection when prompting LLMs for these clinical tasks.
It really seems like getting these LLMs to think more like a human is a major hurdle. Did the researchers dig deeper into that?
Oh yeah, they did. They also tested something called role-playing prompting. Basically, they instructed the LLM to act as a doctor making a clinical decision, trying to tap into all that medical knowledge the LLM has, but encourage it to use it in a specific context.
So it's like saying, all right, LLM, you're not just a language model anymore, you're Dr. LLM. Time to put on your stethoscope and make a diagnosis. Love it. Did this role playing actually lead to any big breakthroughs?
It's interesting because it did seem to help sometimes, especially when the task involved like complex reasoning or making decisions with limited information. The LLMs seemed to do better when they were told to think like a doctor.
Makes sense, right? Doctors are trained to handle uncertainty, to weigh different things, and make judgment calls even when they don't have all the information. Maybe by telling the LLM to think that way, they were able to access some of those same skills.
That's the idea. But of course, we need more research to really confirm this and figure out the best ways to use this role-playing to make LLMs more accurate and reliable in clinical settings.
Okay, so we've talked about chain of thought, self-reflection, role-playing. Any other prompting tricks the researchers had up their sleeve?
One more worth mentioning is in-context learning. This is where you basically give the LLM examples of similar problems and show it how they were solved, like giving it a few practice runs before the big test.
Oh, so they're showing the LLM how other doctors approach these cases, hoping it'll pick up the patterns and use that knowledge in new situations.
Exactly. And this approach was pretty promising, especially for tasks that were, very clearly defined and had those obvious patterns in the data. But for the more complicated tasks, where there's a lot of nuance, in-context learning by itself just wasn't enough to catch up to those traditional models.
It seems like there's no one perfect way to prompt these LLMs. What's the big takeaway here? What have we learned about how prompting affects their performance?
I think the main thing is that prompting is really important in how LLMs approach these clinical prediction tasks. It's not just about giving them data, it's about giving them the right instructions and the right way to think about the problem. None of the techniques were a guarantees win, but they all showed potential. So yeah, prompting is definitely something we need to keep researching and developing.
It's amazing how just changing how we talk to these LLMs can make such a difference in how well they do. So while they might not be ready to replace doctors anytime soon, figuring out how to prompt them might be the key to really unlocking their potential in healthcare.
Yeah, I think that's a great way to put it. It's a really exciting area and one that could really change the future of medicine.
Well, this has been a super interesting deep dive into AI and healthcare. We've talked about the potential of LLMs, what makes those traditional ML models so good, the whole prompting thing, and why responsible development is so important. But like any field that's moving this fast, there's always more to learn.
Absolutely. This research is just the beginning. We still have a lot to figure out about how LLMs work, how they learn, and how to use them in the complex world of healthcare. But the possibilities are pretty amazing.
I agree. It's super exciting. For everyone listening who's as fascinated by this stuff as we are, definitely check out the full research paper, Clinical Bench, Can LLMs Beat Traditional ML Models in Clinical Prediction? It's got tons of information and insights we couldn't get to today. And as always, we want to hear what you think. What surprised you? What questions do you still have? Hit us up on social media and let's keep this conversation going.
Thanks for listening, everyone. Until next time, keep exploring, keep learning, and keep diving deep.
And remember, the future of healthcare is still being written.